Well, dear colleagues, members of the Russian Psychotherapy Association, good morning, good afternoon, good evening. Well, we thank you for the invitation to participate in this important celebration of the 30th anniversary of the Russian Psychotherapy Association as part of the conference, accepting the challenge 30 years of transformation in psychotherapy. We are honored to be in the company of colleagues widely recognized for their contributions to mental health. Our contribution aims to reflect on two crucial questions that define our current practice. The answers to this question can provide us with a roadmap for the future of our profession. Well, transformation. To answer the first question, which addresses the main transformation that has occurred in psychotherapy over the last 30 years, we believe that if we had to choose one central transformation, it would be the shift from a practice based primarily on doctrine to a practice that demands scientific validity, integration, and accessibility. The most significant change was the demand for empirical evidence of efficacy. This movement, originating from medicine, forced all schools to prove their value. The rise of manualized and protocols-driven models, such as cognitive behavioral therapy, is a direct reflection of this requirement. However, the deaf traditions have also adapted. Psychoanalysis, for example, responded with the development of brief and focused psychodynamic psychotherapies. These brief PPS maintain a focus on transference and unconscious mechanism, but condense the technique to be testable and accessible in a limited time, ensuring that insight and depth remain relevant in the world of evidence-based practice. The second transformation lies in the expansion of boundaries, driven by three interconnected axes: technology, model integration, and the dialogue with neuroscience. Regarding technology, the consolidation of telepsychology transformed the therapeutic setting. This broke down geographical and stigma barriers, making treatment much more flexible. In terms of integration, we can state that we have left the war of schools behind. Today, there is an emphasis on technically and theoretically grounded eclecticism and the recognition of common factors of healing. This leads us to transdiagnostic models, which treat underlying processes such as trauma or emotional dysregulation, instead of just diagnostic labels. And concerning the scientific dialogue, this integration extends to neuroscience. Psychoanalysis, in particular, has modernized with neuropsychoanalysis, seeking a biological basis for phenomena like the unconscious and attachment, proving that these central concepts have scientific resonance. What permanence? What about? To answer the second question about what has remained unchanged, we believe that if the transformation lies in the tools and the science, what remains unchanged are the human and ethical pillars that form the core of healing. The immutable pillar is the therapeutics alliance. Decades of outcome research prove that the quality of the bond of trust between patient and therapist is the greatest predictor of success. No technique, no matter how sophisticated, can replace human connection. This connection is sustained by three essential and timeless pillars of therapist: observation, listening, and therapeutic presence. Observation, the clinical capacity to perceive the unsaid, body language, contradictions, and recurring patterns. Listening, profound and evenly, how very difficult this word, but hovering attention, moving beyond the content to capture the underlying meaning and emotion. And therapeutic presence, being there authentically and containedly, offering a safe, not judgmental, and unconditionally accepting space. The greatest legacy of psychoanalysis here is the formalization of transference. It teaches us that healing is not an intervention, but rather the result of the ethical and contained use of relationship itself. What also remains unchanged is the non-negotiable ethical requirement of our profession: confidentiality, avoidance of exploitation, boundary management, and the therapist's needs for continuous self-examination, supervision, personal therapy have not changed. The therapist, as the instrument of healing, must remain a professional in constant training and containment, regardless of whether we are in a physical office or on a screen. To conclude, we propose that the future of psychotherapy is not a choice between science and art, but its necessary integration. We must accept the challenge of transformation to ensure effectiveness and accessibility, but never to the detriment of permanence, the therapeutic alliance, ethics, and human death. Reiterating our thanks for this opportunity, we wish the Russian Psychotherapy Association many more successful 30 years. Thank you.